Is mid-June the breaking point for pretty much everybody in the country on lockdown? We've got a poll that answers that. Plus, the models are claiming that deaths will soon rise because of the reopening. How true does that look to be at this point? How much more testing do we need? What is the COVID Manhattan Project? The truth about Sweden. Supreme Court punts on gun rights here in NYC. And Joe Biden promotes economic intercourse. Coming up.
We're doing everything in our power to heal the sick and to gradually reopen our nation and to safely get our people back to work. They want to get back to work, and they want to get back to work soon. There's a hunger for getting our country back, and it's happening faster than people would think. Ensuring the health of our economy is vital to ensuring the health of our nation. These goals work in tandem. They work side by side. It's clear that our aggressive strategy to slow the spread has been working and is saving countless lives.
Welcome to the Buck Sexton Show, everybody. President Trump addressing the nation yesterday on just how well we're doing here. We got to get reopened. We all know that. The consensus has finally shifted toward that. It's not yet a consensus. There's still a lot of holdouts. There are a lot of people that don't seem to believe that reopening needs to happen. But there's a poll out, and this was linked up on Drudge, which has really just been one big fear-mongering blog for quite some time now on this issue. I'm not saying that they haven't been putting up some things that were important, but there's been no willingness to put alternate opinions up there that I've seen. And also a whole lot of fear-mongering about stuff that's just not true. Look, if we don't have immunity to COVID-19, for example, that would be a shock to the medical community. The expectation is that if we have one disease that's out there that you've had and then it passes based on everything we know about viruses and virology, the expectation is that you will have some degree of immunity for a period of time. Why we have to keep being reminded every 5 seconds that we haven't yet proven that out seems to me to be a catastrophism syndrome here. There are those who, no matter what you say, no matter what the news is, they can find some way to make it negative. They can find some way to tell you, oh, well, that's not proven yet, or that's not going to happen yet. And you say, well, if that's true, if the catastrophists have their way, we're effectively going to be in a state of lockdown forever. Right? If antibody testing doesn't really test for antibodies, if there's no good therapeutics, including hydroxychloroquine, which the left has been rooting against openly, as we've seen, if Gilead Pharmaceuticals' drug remdesivir doesn't work, which it seems like right now, it's dubious that it works. We're not certain that it doesn't work, but it looks unlikely. And if we're not going to have a vaccine, maybe for 18 months, maybe ever, we don't know. Well, then what's the plan? To stay locked down for basically forever and just live like we're moles underground or something in our homes who only get to see the sunlight sometimes? This is absurd. This is completely and utterly deranged. And the people that push this now are very much invested, especially those that have large platforms and those that were doing the fear mongering, including, if you don't agree with us, you want Granny to die. That's what they were saying for weeks, including to people like me, who want a maximum protection of life while also continuing our way of life. And this is a balance. This is not perfect. It's never perfect. And anyone who tells you otherwise doesn't know what the heck they're talking about. But as for how long we could continue to do this, if you listen to those on the left, they keep saying we need better testing. We need better testing. This has become a fixation. We're nowhere close to what they say we have to be, where we have to be in terms of testing. And this is a disease that's largely asymptomatic, that's already spread through 25% of the population, for example, in New York City. What are we going to do? Test everyone every 2 weeks forever to see if they have this? What's really the plan? Yeah, you have testing in place so that people can find out if they have it, and if they have symptoms, they can make sure they self-isolate. But I have not yet seen the plan for what, other than just vast numbers of tests. It's as though we think the test is a cure unto itself. It's not. it's something that we will get to later on in the show. This has become the go-to of the lockdown forever chorus, because they can't just say lockdown forever. So it's, oh, no, just wait until we get the tests exactly right. And when we have widespread testing, which means a factor of, well, I don't want to share the number quite yet, because I think it'll be jaw-dropping when you hear how much more testing we have to do before the lockdown consensus will say we are being reasonable. Remember, testing doesn't prevent spread of the disease, doesn't cure the disease. So it will still spread, and there will still be cases of people who get it and who die from it, no matter how good the testing is. But this is what they're promoting as some kind of an answer to all of this. Meanwhile, the economic bills are getting steeper and steeper. The damage to people's lives and livelihoods is becoming more irreparable over time. Our psychology is dramatically suffering. Our health is suffering. I wonder how we're going to count the dead from lack of preventative healthcare interventions in hospitals because of all the shutdowns of, quote, elective procedures. How many people that are dealing with cancer, getting chemotherapy, that had chemo delayed, that maybe timing was the difference here between beating the disease, getting it into remission and not. You look at the costs that have been imposed upon us, and then what the real benefit so far has been, and there's no mathematical correlation. There is no way to prove, based on all the data we have, that this stuff that we've done was worth it so far. Yeah, the deaths have gone down, but we've been social distancing. We've been much more cautious about spreading this disease. And that's just a matter of public knowledge in large part. But we have also seen a massive spread in areas where it was likely to spread because of population density. We're really going to think that it's a success that we're bending the curve in New York City? A quarter of the city was infected. So, how much do we really think we bent the curve versus how much did this thing spread unrestricted? And then we just showed up and said, okay, well, now everyone stay home and lock down. Instead of what I think would have been a smarter position all along, which is protect the vulnerable. Age and comorbidity are statistically enormous factors in this. If you are under 50 years old and in reasonably good health, this disease is of minimal threat to your life. It's not a zero threat, but it's minimal. If you're between 50 and 70 and in good health, you really don't want to get this disease. You want to be careful, but your odds are still very much in your favor if you did get it, based on all the data that I've seen. If you're over 70 or you're over 50 and have a really serious health problem, you're at considerable risk. And there needs to be an honest discussion about how to make sure that we protect people, and by the way, not just protect them, but protect people who are at high vulnerability, while also ensuring that they have access to what they need, that they are being taken care of, that they're still, if they're people who work, that their teleworking situation or their whatever needs to be done to help those folks. I know a lot of them are going to be retirees, but not all of them. A lot of them are going to be no longer in the workforce. But for those who, and even if they're not in the workforce, need to make sure that we're still very connected to them. There needs to be an effort so that they don't feel like they've been forgotten or they're just being locked away, especially as we now see our medical community has not been able to come up with squat so far to defeat this virus. Yeah, maybe hydroxychloroquine works, maybe it doesn't. Looks like it's probably going to be more of a prophylactic than any kind of actual miracle cure. I mean, I think we're way past the miracle cure stage now. It's not like you take this and you're better. Maybe it's effective in the early stages. But they've done a poll, and this is what I was mentioning on the Drudge Report before. They've done this poll. 72% of lockdown Americans say that they will reach the breaking point by mid-June, which is really what I've thought all along. And I think that they say mid-June, but it's really June. People will be done with this. I'm already pretty much done with it. I mean, I think that the demand that everybody wear masks in public is dumb. It's dumb. There's no real science or data to back this up. It's just fear and panic. And now people have given into this. I mean, when I see people jogging with a face mask on, all I can think about is how uncomfortable that must. And this is normal in New York now. You see people jogging with face masks on. This is absurd. You see people that are on bicycles going 20 miles an hour with face masks on. Why? Well, because our leadership now realizes that they've already imposed heavy costs on our day-to-day lives. They've imposed massive costs on our economy. So for them, it's just why take any risk? Why not take a maximum position of defensiveness against the virus? That way you can always say, I did everything I could to save every life. That's their position now. Just wait until we really start to feel the economic impacts of this, and they'll start to say that they had no choice, that this was forced upon them. You know, right now, they're all heroes saving every life. If it saves one life, they want to do it. When we have to start dealing with the real economic impact of this, there'll be a change. And all of a sudden, you'll hear a lot of these politicians saying, oh, but it was a federal mandate, or, oh, the governor made me do it, or the Congress passed the law that said we had to do this or that, or whatever. They're going to find some excuse. Dr. Fauci said, Dr. Birx said. So just wait for that. No one's going to want to be held accountable, especially when they realize that a lot of these businesses aren't coming back, aren't going to be able to reopen. And when they also realize the federal government's pocketbook is not, in fact, endless, and there will be limitations put on this, and there has been a massive destruction, a real destruction of wealth that has occurred because of this lockdown. 72% saying they'll reach the breaking point by mid-June. A lot of people have already reached the breaking point, they say, right now. 20% of women surveyed have already said that they're already there. 12% of men surveyed say the same. Half of women felt they'll hit rock bottom within 4 weeks, 76% in 2 months. I think that for a lot of parts of the country, this whole approach has just been so clearly wrongheaded and so destructive. And it just shows how there are certain centers of power in the country, one of them being here in New York City, because it's really still the media heart of the country. And, of course, Washington, D.C., and the major cities in general, and the influence that they have on national conversations and on politics. It's well beyond just their population numbers. I think that we see that outsized influence in the decision to really treat all of America like it was New York City. If the rest of the country had New York City numbers for this, first of all, I mean, the death toll would just be mind-bogglingly horrible. It's already a terrible death toll. It's over 50,000. But you can imagine if you extrapolated that out to the rest of the United States, you know, it would be the worst disaster to befall any country in the post-World War II era, for sure. You look at this, though, and you realize that the rest of the country is not New York. So since the rest of the country is not New York, why did we take a New York-centric approach to how to deal with this virus? And I would just note that there were clearly mistakes made in this process. There have been mistakes made all along. The government is not all of a sudden comprised of geniuses who only have your best interest at heart and are not subject to the whims of the mob and trying to please the main editorial boards of large newspapers. All of that is still true of every bureaucrat you see out there. They have pressures. They're just people too, man. They've got their own problems when it comes to giving us just the most astute and correct analysis. It's often influenced by outside factors, and they won't tell you that, but we know that it's true. You also have the lingering effects of this, even if the economy were to open, which is something else I want to talk about. As we're reopening, we're going to see that psychology affects what a reopen even means and what people are willing to do and where they're willing to go in all of this.
If everybody wears a face mask, then you're protecting the other person, because it's really having the asymptomatic individuals wearing masks. But since you don't know if you're one of those, really everyone needs to in those kind of social gathering situations, as long as there's virus still in the community.
When is virus not going to be in the community? This is what I'd like someone to try to answer for me. So we're going to be wearing masks forever? You know, people are going to be going to their prom, not this year even. I mean, next year. Everyone's going to be wearing masks. When does this end? Not virus in the community. You know, viruses in the past have died out, and epidemiologists don't even really know why. They have theories, but they can't really tell you. When does this one die out? When do we get to stop wearing masks? We never have an answer. Until we have a vaccine, The history of vaccines for diseases like this is not something that is going to make you feel much better about our prospects of a vaccine anytime soon or anytime for that matter. So we have to keep wearing masks, huh? When do we eradicate this from the community? I do feel like we've had so many people that we've been on lockdown up to this point, and yet we're still hearing about more and more people, more and more infections. How is this happening if we're all still on lockdown? And we have now, of course, there's going to be some frontline workers, and I'm not saying it could be completely eradicated, but given the extreme situation that we've put ourselves in, where so many people are locked at home, and we've done this for weeks and weeks and weeks, well beyond the incubation period of the virus. Shouldn't the virus be suppressed to an almost, a level that it would be hard to find new cases? Instead, we got new cases here, new cases there, new cases all over the place. Well, how is this transmission happening? Do they ever really look into this? You walk around, for example, in New York, there's no one on the streets. There's no one leaving their houses except to buy groceries. Grocery stores, you got to have masks on. You only have essential workers going into work these days. They have masks on. They're going into buildings that are basically empty. People aren't riding the subway. And we're the test case, right, of the worst situation possible in terms of the spread of this disease for this country. And yet we're still having outbreaks of the disease. So how is it happening? I mean, I think that's fair. I understand that you can theorize for me that someone, like I said, if you work at a grocery store, if you work at one of the few essential businesses that are open, you're being exposed to people all the time. But if everyone's wearing the face masks, we're doing everything that they're telling us to do is really what I'm trying to get at here. And yet the virus is still out there. It's still going to be in the population. Okay, how do we get it to not still be out there in the population? What do we really have to do for that to be the case? Because otherwise we have to just accept, and this is the approach that you are starting to see people understand we have to take. Otherwise, you have to accept that we're just going to have to learn to live with this thing, which was really the case from the beginning. And again, the 2-week lockdown so that we could get hospitals up and ready, get the PPE in place. 2 weeks, this country we could sustain a 2-week lockdown. And let me tell you, I think we're going to see lockdowns like that in the future. If there's a bad flu season, people are going to say, we're going to lock down the whole state for a week or two. And if you disapprove, it's going to be because you want Granny to die for your 401k. We've already run this test. And a lot of people fall right into that. They think that that's fine. But okay, you had a 2-week lockdown that extended into now a 6-week lockdown that's about to extend for most places into a 10-week lockdown. And yet we still have to be in fear, constant fear of this virus everywhere, even though we're taking all of these precautions to prevent the spread of this virus. I mean, shouldn't the transmission of this virus be down to the last month, 95% across the country? Shouldn't it have just fallen? If what we're doing is really that effective, shouldn't it have just fallen off a cliff? I'm asking questions here. I mean, I don't have all the answers. Some people pretend to. Some people are hiding out in bunkers somewhere, trying to tell all the rest of us how we should be operating. I'm here in New York actually doing stuff, getting out there, and I want answers to these questions for reasons of my day-to-day life and for the country. All right, we've been telling you that we're going to take a look at states around the country as this reopen process unfolds. We have Congressman Andy Biggs, who represents Arizona's 5th district, with us now to tell us what he sees at the state level, also at the national level with all these things going on right now. Congressman, thanks so much for making the time for us.
My pleasure, Bud. Good to be with you.
All right, let's start if we can with your op-ed, the Fauci Birx Doctrine of Destruction. This was in the Washington Examiner. It was by you and Representative Ken Buck. What is the doctrine, the Fauci Birx Doctrine of Destruction, just so folks can all get on the same page here?
Yeah, what we're talking about is an absolute disregard for everything else other than their policy of trying to contain this virus. If that means quarantine everybody, whether you're healthy or not. It means basically shutting the entire economy down. It means abrogating civil rights and constitutional liberty. That is the doctrine of destruction that I see in these two.
And what are you hoping the administration does from here on out? It seems like the president is offering states like yours, Arizona, the ability to make some of their own determinations about the speed. They've put out guidelines for them. They've said they'll backstop them. Is that the right federal response? Is there anything else you'd want to see other than perhaps, as you note, a little bit less reliance on the Fauci-Birx advice, but anything you want to see from Trump and the federal response?
Yeah, I think there are 2 or 3 things they should do. I think the first thing they have to do is they have to bring confidence to the public that that we're coming back to normal. And the way you do that is you got to move Fauci and Birx off stage, and you got to start talking about other realities with regard to this, where other folks have said, basically come in and said this quarantine is a real problem. You have to tamp down on the societal impact of the Fauci-Birx doctrine, and that is to say you have increased suicides, you have child abuse increase, domestic violence, you have drug and alcohol dependence increasing, and then you also have the economic considerations as well. So you have to tamp down on what Fauci and Birx have done, and you have to step up with the confidence building on the bully pulpit side. And the third thing you have to do is you have to recognize we're a free people, we're a responsible people, and you provide opportunities for people who don't want to come out, who want to stay in, and those who probably should stay in, the most vulnerable who should stay in, you let them stay in, and you keep outlining that doctrine over and over again, but you open up this country and you encourage governors to do so. And you also remind them that should they continue to abrogate civil liberties and destroy their own economies, there will be no backstop from the federal government.
We're speaking to Congressman Andy Biggs of Arizona. That was actually my next question for you. What do you make of the current back and forth over, it's really between Mitch McConnell and some assorted Democrats, where there's already talk of a bailout for the states? There are clearly some Democrat states that are much more indebted than any of their more red counterparts. Do you think that Congress is going to move in this direction? And what's your argument for or against any kind of direct financial assistance to states that have been hit particularly hard by this?
Well, I think we have to stake out a position. I think McConnell's staked out the right position. That is when he has said, look, we are not going to backstop these states, and we shouldn't be backstopping the states. You have states like Arizona that had built up a surplus because of careful fiscal constraints, and they had over $1 billion in their rainy day fund. Well, now they're going to be in debt anywhere from $1 billion to $2 billion, and that's on a $9 billion, $10 billion budget. So that's really enormous. But on the other hand, you've got Illinois with huge pension debts. You have New York with huge pension debts. Both of them have huge structural deficits and debt to their state. We shouldn't have to come into debt to backstop them. And that's one point. The second point, Buck, is as well as I do that a lot of the draconian measures that these governors have undertaken to their economies have devastated their economies. And now they want us to come in and back it up. I think of Larry Hogan in Maryland, who basically shut down all of Maryland, just shut it down completely. And now he's saying, you guys, the federal government should backfill for us. But that isn't the way it works, because the government isn't some entity that's amorphous and just out there. The government in the United States of America consists of you and me and everybody else. So when they say government should pay for it, federal government should pay for it, they're saying you and me, and moreover, they're saying our grandkids should be paying for what Maryland did to its own economy.
How is your state doing so far? And then we can talk a little bit about what the future holds. But how has Arizona been in your estimation? Obviously, this falls largely in the governor's hands. How's the governor been doing? And what would you say about where your state is at this point?
Well, I think Governor Ducey's really tried to walk a line here, but I don't think we've opened up nearly as fast as we could have and should have. I get concerned about hospitals. So once you leave Maricopa County, which is the Phoenix metro area, there's 5 million people there. The rest of the state is 2 million people. And so you have a lot of rural areas, and you have a lot of rural hospitals that are going to shut down because they've been told you can't open up for elective surgery. And that's been a huge mistake, in my opinion. They've shed employees, and a lot of them are the biggest employers, or one of the biggest employers in small towns in rural Arizona. The other thing I would say is, it's been bewildering to many of my constituents why you can go to Walmart and you can basically, social distance and shop and be responsible, but you can't go to the neighborhood furniture store, some other brick and mortar retailer, which are your neighbors, and they're dying on the vine here because they're not getting any foot traffic and people can't work. I think we need to be opening this up, and in Arizona, in my opinion, we're behind a little bit, and yet at the same time, we had not ever hit the surge that the models all told us that we'd hit by now.
How are small businesses doing? And we're speaking to Congressman Andy Biggs in Arizona, of Arizona and in. Congressman, how are small businesses doing, and how do you think the PPP is going so far? Again, from what you're hearing from constituents, we want a sort of on-the-ground view.
Yeah, so we get more calls about PPP than anything else, and it's small businesses being frustrated because it looks like big business really is kind of sucking up some of this money again. And, so I spent a lot of time yesterday talking to constituents after this reopened out here for PPP. Those who have received it are grateful, and it's going to help, but a lot of them are facing the reality that the employment benefits that have been increased by the feds are actually providing a perverse incentive where people don't want to come back to work, right? That's craziness. The other thing is too, we're probably going to lose 30 to 40% of our restaurants here, which is a huge industry. Don't forget that in Arizona, this best time of the year to be here is from February till right about now, and we've been shut down the whole time. That means hoteliers, all the service economy that supports all the tourism industry, the spring training baseball, everything that brings in hundreds of millions of dollars to this economy, basically shut down. So it's really killed our small businesses. We could have been doing things like getting a tax holiday to our small businesses. We chose not to do that, and instead we've got this money out there, and it's going to some places where I actually know of some businesses that are doing really well here, and they're getting some of this PPP money, and I know other businesses that are really struggling not getting it. So it's really been a convoluted, bit of a discombobulated.
Do you think that some of do you think that some of the states that are opening on the earlier side and that are taking more of a leadership position in the reopen, Texas comes to mind with Governor Abbott, do you think that will have an effect not just on neighboring states but across the country, assuming that the reopen goes without some major spike in cases? Is that going to pressure some of the slower to reopen states, or you think that places are going to, has this honestly just become too political an issue for the facts to matter all that much?
I think some places you're going to see it cause some pressure. So you'll get some peer pressure. You got Georgia. I think it's going to do okay. I think Colorado with Jared Polis, who's he's just a total liberal Democrat, but he's opening up his state. And I think you're going to see this pressure come on places like Arizona where we could be opening. But on the other hand, you've got these blue governors in blue states that are using this for political opportunity, and I think that they've got some real disconnect, if you want, some with regards to opening up. I just don't think they're ever going to open up without more pressure, and that comes from the people. I hear these governors talk about power. We don't have power. If you're an elected official, you don't have power. You have authority delegated to you by the people. The people have the power. And the people need to be rising up saying, we're ready to go to work. And you're seeing that. You're seeing a nascent movement. And you're seeing also places like social media is trying to shut them down and not letting them organize. You're seeing some governors and trying to get out and enforce against those kind of protests. But those protests are the heartbeat of America. And they're going to actually, I think, push forward opening it up.
Congressman Andy Biggs of Arizona, appreciate your time, sir. Thanks for joining us, and we'll be in touch. You take care. Stay safe.
Thanks, bro. Yeah, you too. Stay safe, man.
What we've talked about, and even in phase 1 and phase 2, we've asked people with pre-existing conditions and comorbidities to continue to shelter or shelter as much as they can. And that's part of social distancing. And then everybody who's in those households has to be scrupulous in their hygiene, in their protection, in their social distancing while they're out. And the reason this has become more and more important is we're beginning to understand more and more that there may be an inverse relationship for how severe the disease is and your age. So younger people could actually be infected and not know they are infected and unintentionally pass the virus on. And so that's why we need everyone to be responsible and everyone to take care.
So you see, everybody, by this logic, then gets dragged into the most extreme lockdown scenario. Schools have to be closed. Children aren't allowed to go to school. Might not be going to school even in the fall, even though they're at very little risk from the disease itself, because of the prospect of possibly passing an asymptomatic, for what is for them an asymptomatic infection onto somebody who is older. So here we have it. Instead of protecting somebody who is at risk, we are telling everybody to act like they are at risk too. This is a problem. This is not a successful long-term approach to this disease, and we have to start thinking about a long-term approach. The people who thought it was so clever to just lock down and say lock down as long as it takes, they're going to look very wrong with this. This is going to look like a foreign policy, a domestic policy disaster in time. That was not the right move. It may have been the right move for certain states at a certain time. Again, I reserve that it was possible, maybe even probable, that New York and the surrounding area needed a total lockdown because of how badly the disease had already spread here. But in other places, why would anyone think that, the suburban areas of, Minnesota or rural areas of Utah should be under similar restrictions? I mean, you can't go to stores to buy normal stuff in states where they've had there are counties in Texas, for example, where they haven't had a single case of COVID-19. Whole counties, lots of them. And the stores are all shut down. They're all shut down, and there's a disease that hasn't even spread to a single person there yet. Well, somehow they were, even without the lockdown, they obviously didn't have a big spread because it had spread all over New York by the time we actually put a lockdown in effect. So in some of these other places, when the virus was able to spread freely all across the country, there were basically no cases in certain counties because maybe it's a transmissibility issue. Maybe it's the demographics, younger people, older people, who knows? But those counties are all in lockdown too. It's just wrong. It's a bad idea. And the punishment that we're doling out here to young people in particular, and I mean really young people. I don't mean people that are around my age, because I'm at a kind of a little bit on the bubble of, I know people that are, there are cases of people who are my age who have gotten very severe versions of the disease. It can certainly happen. People my age have died from the disease. It can happen. But if you're under the age of 20, your risk from this, technically you could get strep throat, I guess, and die, right? If strep throat continues, I forget the progression, but there is some way I think it can actually infect your heart, the bacteria. So it's possible to die from a lot of things, but no one worries about it. If you're under 20, your worry from COVID-19 at this point should be zero. Your worry for your own safety should be zero. Now, your worry for grandma or grandpa, if they live with you in the same house, that's a different story. But you also then have to remember, why is it a better idea to make sure that everyone is then staying at home all the time? How does that help out? Wouldn't that increase the viral load in an enclosed space in a household by having somebody who's not able to go to school, who's not able? And, now people are talking about herd immunity, which I want to bring back up because this is a maligned concept. This is still, people treat this like you're advocating for eugenics or something when you talk about herd immunity. Herd immunity was the medical standard for dealing with cases of disease spread like this for a long time. This was what was understood to be, this is what you're trying to achieve. You either get vaccination or herd immunity, but this is not some new evil theory that came up where people want to sacrifice the old and those with health issues in order to promote a robust economy. And it is certainly the case that there are going to be problems with the economy, slowed down aspects of the economy even once it reopens. That same study I mentioned to you from the Drudge Report that was commissioned by Kelton Global, which is a research firm, found that 69% of Americans are extremely worried about flying on an airplane again, 76% taking a cruise. That number should be like 99. Going to it because I just don't like cruises, and I think it's a really, there's too many of these times when the disease is just spread all over the place on a cruise. Going to a restaurant, 62%. I think that's a little extreme. Using a ride-sharing service, 58%. I also think that's too extreme. I will tell you right now, I would, with the windows open and a mask on, I would take an Uber. I don't think that that's an undue risk. Everyone also, you notice, has to be their own arbiter of their own personal risk. The problem with what we've got going on right now is it's the government telling you, you don't get to make those determinations and distinctions. We tell you what you're allowed to do, even if it's not rooted in science, even if it's wrong, and even if it's illegal and unconstitutional, which is a word we should start to use again. Unconstitutional.